Thanks very much for the introduction. Thanks very much for the invitation. Good afternoon, everybody. I'm going to talk about the relationship between neurofeedback and tinnitus and the pros and cons of this particular approach. The title of my talk is Take Back Control. I mean, this implies, let's say, the basic idea behind neurofeedback, right? So patients should, let's say, learn to take back self-efficacy in a way. I'm going to talk about EEG-based neurofeedback only, so I'm not going to talk about fMRI neurofeedback, which has also been, let's say, tested in the context of tinnitus, but this is something I'm going to ignore today. Well, neurofeedback, this label implies that neural signals rather than visceral activity are modulated. So I'm only concentrating on this particular part of the approach. Well, I mean, as already mentioned, the discussion, there is not, let's say, undivided enthusiasm about the approach of neurofeedback in tinnitus. On the contrary, there is still a suspicion that EEG neurofeedback might be largely based on the placebo effect, and this diminishes its popularity, at least in the scientific community. However, the fact that EEG is part of this approach, and the EEG analysis have already provided a means to demonstrate the objective effect in changes in the electrophysiological activity, might bear some advantages, right? So there is a kind of objective measurement now, which may help as a kind of additional control. In tinnitus, one of the biggest problem we are faced with is the immense heterogeneity, right? So I'm not going to speak about this in detail, but I mean, we very rarely see tinnitus patients who resemble each other. So each particular tinnitus patient has his or her own history and needs, let's say, special treatment and even say special way to talk to them. So we have a lot of different subtypes, but no, let's say, systematic kind of categorization. And I mean, as you probably know, to date, there is no treatment in tinnitus that all people agree on as a kind of effective way to get along with this symptom. There are a lot of approaches and interventions and proposed treatments, and neuro or biofeedback is just, let's say, one out of many. This is probably the reason why neurofeedback, due to my knowledge, hasn't been so far recommended as let's say, kind of official treatment. Today we know by looking through the glasses of neuroscientists that tinnitus is a symptom that cannot only be constrained on the auditory cortex. It is attributed to a lot of different regions in the tinnitus brain. So today, let's say we think in terms of a multi-component network where the auditory cortex is, let's say, only the core area, while many extra auditory areas in the frontal cortex, in the subcortical limbic areas, in the subcortical insular areas, in the cingulate areas are also part of this network, which of course makes, let's say, the treatment much more difficult. According to this review paper published by Dick Sadley in 2016, there are a lot of competing models that try to, let's say, explain tinnitus generation and tinnitus maintenance in the human brain. All these models more or less agree in that tinnitus can be seen as a kind of acquired oscillopathy, which means there are aberrant band power of the alpha band, the delta band, and to some extent even the gamma band. And the aim of neurofeedback is a respective normalization of this aberrant band power to counteract tinnitus symptoms, namely distress and intensity. So in particular, two, let's say, of these frequency bands play a prominent role in the neuro pathology of tinnitus. It's the alpha band and it's the delta band. It has been observed that a decrease in an alpha band power over temporal auditory cortical regions is, let's say, mainly interpreted as a failure of the tinnitus brain to suppress peripheral auditory input or generally reflect a lack of inhibition. Delta activity, on the other hand, is generally attributed with general de-differentiation of peripheral input, which is also applicable for the majority of tinnitus models. Increased delta band power has been identified as a neurocorrelate of the phantom sound in original work of the group of Nata and Weiss as a possible consequence of differentiation. So this is, let's say, what can be seen in the tinnitus brain, an abnormal or unwanted decrease of alpha power and a decrease of delta power. And the basic aim of the basic idea of neurofeedback is to let's say end up with a kind of reversed order. So the neurofeedback approaches I'm going to introduce in my talk are not simply about the beneficial aspects of relaxation. On the other hand, these current neural targets are based on a putatively tinnitus-specific neural alterations I've just been introducing. I'm going to introduce a series of studies that have been done. The one, really important and probably the first pioneering study had been published by Dorman and al. In Progress in Brain Research 2007. This neurofeedback study, let's say the aim was to counteract the maladaptive band power changes in the alpha and in the delta band. In 10 sessions of 30 minutes, participants either trained, let's say, a change of the alpha-delta ratio or alpha upregulation or delta downregulation at a set of limited electrodes, frontal electrodes. Only 4 electrodes putatively cover auditory cortex activity. They also investigated a control group, and this control group performed an auditory discrimination tasks which had been described elsewhere. The results of the study here were indicative of reduced tinnitus distress, reflected by the line here, intensity and the changed alpha-delta ratio after the training period, but not in the following up period. In addition, the tinnitus intensity changes were negatively correlated to alpha and delta ratio changes in support of the hypothesized relation between behavior and brain activity. There was no change of tinnitus parameters in the group performing the auditory frequency discrimination task. And finally, the alpha data ratio changes were most predictive of the tinnitus treatment. For this reason, we decided in Zurich to do a kind of replication studies a few years later. We increased the number of sessions to 15, and we identified the individual alpha frequency in participants and combined it with the delta frequency. We used the same set of electrodes as used in the study of Dorman et al. And as, let's say, a kind of neurofeedback, we use this sort of gamification feedback with a spaceship that had to be navigated through a tunnel. here you can see the design of the study. As I mentioned, 15 weekly training sessions, about 15 minutes of duration. We combined EEG measurements and training sessions with a lot of questionnaires and tests to get the best picture possible about what kind of tinnitus patients are included in the study and about the changes that occur over the course of the training. Also, during the 15 training trainings, we constantly tried to track training process before and after each training. So we recorded short resting state EEG combined with the questionnaires. So here's a list of questionnaires. I don't know whether, let's say, the presentation, the slides will be available, but of course I would be happy to share them. So just let me know and I'm going to distribute them. So here you can see the behavioral results, the tinnitus questionnaires, the tinnitus health inventory, tinnitus questionnaire, and the loudness rating. And as can be seen, decreases in, let's say, self-report questionnaire scores and intensity were found, which partly also persisted through the follow-up period up to 6 months after the treatment end. However, of course, this does not, let's say, mention anything about the objective success of neurofeedback. And for this reason, we also analyzed the EEG data, the resting state data, and our neural data partly corroborated the behavioral findings, especially in the case of the alpha data ratio on all electrodes when tinnitus was attended in the outcome resting state EEG recordings. So this is the effect here between first and second measurement. Another study that had to be mentioned is published by Hartmann and colleagues. This was the first study that used a tomographic approach. So a kind of source-based approach. And in this particular study, the authors iterated on the NFB, the neurofeedback protocol, in focusing on alpha power exclusively and applying this tomographic approach by confining the trained region to bilateral temporal auditory areas only. The neurofeedback was compared to a rhythmic transcranial magnetic stimulation approach, including a sham condition. And according to the results, the superior performance of the neurofeedback protocol in contrast to the TMS and the sham condition in both behavioral tinnitus questionnaire data as well as in the target alpha band auditory cortex location could be shown. In Zurich, we prepared, meanwhile, a second neurofeedback study. In this study, we also aimed at applying a tomographic approach based on source estimation algorithms, specifically targeting the auditory cortex. And so in this particular study, we did not find, let's say, a superior result of the tomographic study, but let's say some behavioral progress measured by the temporal health the tinnitus health inventory, while the tinnitus questionnaire did not show any positive results. Interestingly, we didn't find any differences between the two groups, the group of the former study and the group that performed the tomographic neurofeedback protocol with regards to symptom reduction and neurophysiological changes, outcomes except the reduction in tinnitus loudness after the training for the Beretta group. With respect to the electrophysiological results, tinnitus health inventory scores and the neurophysiological alpha data ratio changes remained stable over the time course of the 3 months of the follow-up period. So concluding, there seems to be no significant added value of source localized approaches for the neurofeedback training in tinnitus, at least as long as only auditory cortical regions are the distinct target of the feedback. For this reason, we performed a third study that, let's say, used a kind of multifocal approach. So here we not only targeted auditory cortex activity, but also targeted regions beyond the auditory cortex, namely the insula and the anterior cingulate cortex, which are related to distress salience perception networks. And according to the literature, we slightly changed, let's say, the frequency and the band power of the oscillatory activity we tried to change. And in this particular region, we only recruited older persons, middle-aged persons and older persons as participants. Unfortunately, we only have some behavioral effects so far. And what we can say here, I mean, the neurofeedback protocol also appeared to work. It, let's say, helped to decrease the self-reported distress of the individuals in two groups that varied in intensity of the training as well as in the perceived loudness. In a book chapter that Patrick Neff and I have written up, and that is going to be going to appear soon, we included this table here. And according to this table, you can see also other neurofeedback studies in tinnitus that I haven't mentioned explicitly. I would like to emphasize the study of Sven van Este et al., which used a more sophisticated protocol and yeah, to some extent, let's say, a different mechanism. And in addition, the study of Jensen et al. That hasn't been published so far. So Martin Jensen provided me with this slide, and yeah, I think it is definitely worth introducing, because this study also came with a very sophisticated design. It's a 3-arm study using alpha-delta ratio training as well as beta-theta as a kind of neurofeedback control. And a third group that performed a kind of mini intervention that was completely independent from, let's say, tinnitus treatment. According to this study, one can say, well, yes, there is success in, let's say, the reduction of tinnitus symptoms measured by the THI as well as a particular loudness score, as far as I remember. However, the specific hypothesis, let's say, that emphasized efficacy of the alpha-delta ratio was not verified, because the beta-theta ratio also changed the function of the neurofeedback training. But despite of this unspecificity, the authors emphasize that there's a trend for greater tinnitus alleviation for the alpha-delta ratio training on the both primary outcomes, THI and TMI, which can be considered clinically meaningful. Well, given the inherent complexity and the infinite parameter space of this method, as well as the large spectrum of the targeted, let's say, heterogeneity in tinnitus, there are still many issues and open questions which have to be addressed with scientific scrutiny. So despite some progress I've been introducing, there are a lot of concerns regarding the heterogeneity of the prime symptoms, distress, duration, compensation, and there is no idea how to deal with them according to, let's say, a setup of a specific or individual neurofeedback protocol. There is the existence of non-responders. So people who principally do not respond to that kind of training, and we don't know why. We have to find, let's say, an explanation for the mismatch between behavioral and neurophysiological results. Of course, let's say if you take a mean and you find relationships, significant relationships between changes in the neurophysiological patterns as well as changes in the tinnitus scores. But if you take a look at the individual level, this does not hold true for all the participants. There is a desperate need for better statistical models. One of our former PhD students, Constance Riemer, has published some very noteworthy papers on this particular issue. There is still a lack of coherent causal / neural models of the tinnitus brain, which can serve as, let's say, a really reliable platform for functional neurofeedback protocols. If you want to learn more about that, and if you want to read, let's say, a comprehensive discussion of all these bits and pieces, please wait until this book chapter is going to be published. For the moment, I would like to thanks for your attention, and I would also like, of course, to thank the sponsors for supporting our work.